Obesity in America affects over 35% of adults, according to the American Heart Association. And certainly as plastic surgeons, we reach out and help many of these people as they reacclimate to everyday life following massive weight loss, either from diet and exercise or from surgical intervention today. So what can we do to make these people's lives better? And what innovations in body contouring have really changed them? Not only has it been with facial rejuvenation and tummy tucks and body lifts, but also new and innovative techniques in thigh lifts. In these two articles, they review the risks and the options of these procedures. The first study sets out to define the risk of complications of thigh lifts. They looked at over 106 thigh lifts performed over 10 years and determined that this procedure had a high rate of minor wound healing complications, and up to 2/3 of these patients had at least one complication, including swelling of the legs or the sutures opening. However, despite this higher risk of minor complications, the patients liked them. They remained a popular procedure, and over 8,700 were performed in the United States in 2013. Because the patients felt better, they looked better, they could walk better. The next article actually investigates how it also improves the quality of life for these patients, especially the massive weight loss patients. They sent out a questionnaire to 21 massive weight loss thigh lift patients, and this French team determined that a thigh lift can improve a patient's self-esteem, their physical stature, their social life, and even their ability to work. According to these authors, thigh lifts seem to improve the quality of life overall in these massive weight loss patients significantly. Once patients have lost all their weight, many times they can't exercise because they have so much extra skin in their thigh or in their abdomen. So to make their quality of life better and actually to allow them to keep the weight off, you have to remove this extra skin, whether it's a body lift, and certainly in the thighs, they need that to walk. So a thigh lift is actually both functionally and aesthetically very important because they'll look better, feel better, and they'll be able to exercise. And that's the most common response I hear from my patients, is that they truly can exercise. In fact, one of my patients recently ran a marathon that she hadn't been able to do since she lost her 150 pounds from a gastric bypass. So that's a very important part of this procedure. I think the role of the informed consent is so important in all of these procedures, especially in massive weight loss body contouring procedures, because you're trading off incredible improved quality of life and results for long scars all over your body. Whether it's around the abdomen or in the inner thighs, you'll have long scars. And with that comes increased chance of having small little minor complications like suture opening or wound opening. And they heal fine in my experience in a high majority of patients. The key is, find a board certified plastic surgeon that has expertise in doing sculpting in the massive weight loss patient. That's very important, and follow their instructions. And also, these procedures are multiple stages to be safe. So, is a thigh lift right for you? I would echo the sentiments of both groups of authors. Visit plasticsurgery.org to find a properly trained board certified plastic surgeon who will give you these options, talk to you about the complications, and then go consult with one or two board certified plastic surgeons. And of course, subscribe to PRS channel for more monthly updates on hot topics in plastic and reconstructive surgery.